Good evening, sir. My name is Prof Osinbajo. I work with an organization that is into maternal and newborn health. And when we saw the manifesto of the APC on health, there's an area that says that the APC will reduce maternal mortality by 70%. Now, the best performing country in the world that is doing well in reducing maternal mortality is Belarus, and they were able to reduce maternal mortality in 23 years by 13%. The annual average of maternal mortality in Nigeria is 3.3%. How realistic is the plan to reduce maternal mortality by 70% if your party wins the election?
And that's a huge number. If you talk of Belarus or any other place, it depends on what it is that you're coming from. If, for example, you're coming from 20%, if you're coming from mortality of, say, 1,000 women are dying a year, and you're trying to reduce that, you may look at 13% as successful. You may think 13% is successful. But for us, the sheer number of the extremely poor in Nigeria, we think that the interventions that we intend to bring about, all of the interventions we intend to bring about, must lead to a dramatic drop. And that's why we're looking at figures of 70%. It must lead to a dramatic drop. One of the reasons why maternal mortality is extremely high at the moment is extreme poverty. Extreme poverty. Extreme poverty means that these people cannot afford 200 naira to feed themselves and their families in one day. That's what extreme poverty means. That they cannot pay 200 for themselves and their families in one day. A person who cannot feed, a person who does not have 200 naira to feed himself, herself, and family, how can such a person access medical help when they're pregnant? So we think that dealing with the problems of poverty in the way that I've described, and also raising the standards in our healthcare, as our healthcare plan proposes, will drastically reduce maternal mortality. Belarus and those kinds of places that you're comparing us with simply don't have the kinds of challenges that we have. And we think that a quantum leap in dealing with poverty will mean a quantum drop in maternal mortality